Today's topic is shock. Shock is a state of poor perfusion with impaired cellular metabolism manifesting with severe pathophysiological abnormalities. It is due to circulatory collapse and tissue hypoxia. To understand this topic, you first need to know the difference between shock and ischemia. Ischemia is simply lack of blood to a specific body part or tissue, and in contrast, shock is lack of blood supply to the whole body, and this can lead to multiple organ failure if not treated early. It is also important to know that shock is a condition affecting the circulatory system, which is the cardiovascular system. The cardiovascular system comprises the heart, blood vessels, and blood. So shock is due to any impairment of the heart, blood vessels, and blood. If the heart is not functioning normally, like it's failing to pump blood, this can lead to shock because the body will not be receiving oxygen and nutrients it needs in the blood, which keeps it to function normally. Number 2, if the blood vessels dilate abnormally due to some factors we are yet to look at, there will be low blood pressure, meaning the body will not be receiving enough blood it needs to function well, hence leading into shock. Lastly, if there is reduced blood in the blood vessels, this is straightforward. The body will not be receiving enough blood since there is no enough blood to reach the body organs, hence resulting into shock. Coming to the types of shock now, mainly there are 3 types of shock: hypovolemic shock, cardiogenic shock, and distributive shock. Let's start with hypovolemic shock. This is due to reduction in total blood volume. This type is further divided into 2, non-hemorrhagic shock and hemorrhagic shock. In non-hemorrhagic shock is reduction in the amount of blood due to dehydration, like from vomiting and diarrhea, and hypovolemic shock is due to rupture of the blood vessels leading to severe bleeding, like from an injury. Cardiogenic shock is due to trauma to the heart or failure of the heart to pump blood, like for example in myocardial infarction and congenital heart diseases. This type is further divided into obstructive shock. It's called obstructive shock because it's also as a result of the heart failing to pump enough blood to all parts of the body. Obstructive shock can be due to obstruction in the contractility of the heart muscles to pump blood. And remember, if the heart doesn't pump blood, the whole body will lack blood, which will in turn result into shock. Coming to distributive shock, in this type, the part which is affected are the blood vessels. They become abnormally dilated, which reduces the blood pressure, and in turn the body will not be receiving enough blood, hence leading to shock. This type is further divided into 3. The first one is septic shock. This is due to the presence of pathogens and microorganisms in the blood vessels. These pathogens produces toxins which causes abnormal dilation of the blood vessels, which in turn leads to hypertension and lastly into shock. The second one is neurogenic shock. In this type, there is damage to the nerve surrounding the blood vessels that helps in the contraction and relaxation of the blood vessels. In this type, you find that due to damage of these nerves, there will be abnormal dilation of the blood vessels, which further leads to hypertension and shock. The third one is anaphylactic shock. This type is due to allergic reactions which produce some chemicals that dilate the blood vessels and hence leading to hypertension and shock. So we can say that the causes of shock are sweating, vomiting, diarrhea, bleeding, myocardial infarction, congenital heart diseases, pathogens, damage to the nerve surrounding the blood vessels, allergic reactions, and so on. The signs and symptoms of shock include high pulse rates, which is tachycardia, sweating, hypotension, restlessness, tachypnea, collapsed veins, cyanosis, and etc. On the investigations, you can do the following: regular monitoring of blood pressure, heart rate, and respiratory rate. You can also do central venous pressure, pulmonary capillary wedge pressure. You can also do arterial oxygen saturation. You can do computed tomography to locate the site of septic focus. You can also do some ultrasound scan to locate the site of pathology. You can also do some x-rays of the affected area and so on.